Hello and welcome to episode 2 of the Advice Matters podcast. My name is Alan Bruzon. I'm the Chief Officer of Citizens Advice Eastbourne. And this episode is going to be about our latest report entitled Nothing Has Changed, which is a report about sickness and disability benefits, two of the main subjects that make up a huge amount of our work. Things like personal independence payment, advising people with the various issues that come up from those applications, and also employment support allowance, the main things that people rely on when they become sick or disabled. The title of the report, Nothing Has Changed, comes from the fact that we did a report of a similar kind in 2018, and it was followed by Citizens Advice East Sussex producing another report which was echoing the same findings and information in 2019. And since then we've had the pandemic, we've had the cost of living increases, and throughout inquiries about PIP have remained a solid quantity of our work. One of the most time-consuming and demanding areas that we deal with, and it's just remained solid throughout the pandemic and throughout the cost of living crisis, and that in itself is a curious fact. There's nothing unique about Eastbourne that explains this. This is replicated nationally, and it covers people with all manner of health conditions and disabilities, and too many people are being rejected by the system when quite clearly they meet the eligibility criteria for those benefits and therefore should not be being refused. There's more information in the people that I speak to that explains what's going on. But this has been something of a national scandal, I think, for a number of years. And that's why we're campaigning and continuing to campaign to get things improved and changed, because we want to prevent other people from having exactly the same difficulties. The benefit system is a form of financial support, and it's a safety net for a lot of people. You never know when you might need to call on the benefit system. Health can be a fragile thing, and if you suddenly get a diagnosis of a major health condition, you could be pushed into this world of claiming disability benefits or sickness benefits, and sometimes this journey is not straightforward and it's not easy, and there are many barriers put in people's way. It seems really as if the system is designed to treat most people as if their claim is not genuine, when actually our experience is that the vast majority of the people who come to us, you would speak to for 5 minutes, and it would be very clear that they have a major condition that is affecting their health and their day-to-day living, and therefore they're eligible for this extra financial support, which is to pay for the extra costs that come with long-term health conditions and disabilities. So I'm going to talk to a few members of our team who are involved in this, and then we're going to look at the recommendations in the report, which is available to download from our website www.eastbournecab.co.uk, and it's on the front page. So I'm with one of our research and campaigns volunteers, Greg Smith, who's joined us recently, and he was the person who put together the statistics that are in our report. Welcome, Greg. So you went through our database and picked out these statistics about our inquiries and looked back to what happened in 2018 and back to the present day.
Yes.
What was the overall picture that you got, and what's happened to our inquiries during that time?
So certainly one area of benefits that we're asked to help with the most is personal independence payments, usually known as PIP. So this is a non-means tested benefit which is designed to assist with the extra costs of disability and long-term health conditions, mainly for working age people. So our cases for PIP have increased quite significantly since 2018 by about 32%.
Right.
And the proportion of the total number of cases that we do overall has also increased for PIP. Overall, in terms of all the other benefits as well, living disability and health related benefits that we help people with, they've increased by around about 10% over that period from 2018 to 2024.
Right. So significant increase, significant change.
And I think, and that's very much constrained by the resources that we have. I think if we had more resources, that there wouldn't be any shortage of people that we could help.
Yeah, you're absolutely right. Yeah, and one of the things that affects our figures, it's not necessarily about the demand; it's about the actual capacity,
exactly.
as you're saying. So, if we lost a member of staff who helped 200 people a year, it would look as if our figures have gone down, when actually the demand remains very high. And I'm just looking at pages 4 and 5 here, and noticeably, I can see on page 5 this big block of blue, which is representing personal independence payment, and it seems to have stayed as this really solid block of our work, despite the fact that we've, since 2018 we went through the pandemic, and then now we're in the cost of living crisis, but this bit of our work has just remained absolutely steady throughout, and it is our largest inquiry area.
Yes.
Is there a way to explain why it doesn't change? It just remains this solid block. It does increase slightly, but it doesn't reduce by any means. And the pandemic didn't do what we might have expected it to, because it didn't seem to bring a lot of people affected by long COVID or COVID itself. Is that right? Do you get a sense that these are just general other conditions that have remained at a steady level?
I think the general number of applications for PIP overall nationally has increased significantly.
Right.
A large percentage of that increase has been around mental health disabilities.
Right.
I think also, with the cost of living crisis, more people are looking at other sources of income that they might be eligible for. I think there's a bit of that as well. And that's also backed up by national information where, although PIP is a non-means tested benefit, only around 8 to 10% of people that receive PIP are actually in work.
Yeah, that's something which people might not be familiar with. I think you mentioned to me about people who really rely on PIP to be able to stay in paid employment.
Exactly. There's people that rely on PIP to help with mobility, so they can get to their workplace. People that rely on PIP to help them get up out of bed in the morning, to enable them to get to work with the physical disabilities that they might have.
Yeah, the report has this section which we call the deep dive into personal independence payment, where we break down what the inquiries are about. And there's these different stages from the application itself, which is quite a considerable chunk of our work.
Yes.
And then the later problems. So let's talk through what happens, what are people experiencing with the application itself?
So I think the application is a paper form, so you have to ring up and request it.
Yeah.
Even that's made quite difficult. You have to ring a national hotline, which isn't staffed to meet the demand. So it's quite challenging to get that initial form sent to you. And then there's quite a long form.
And we have several people, mainly volunteers, who help people complete forms. What's the process like of actually, are the forms straightforward? Are they easy to complete?
They're not easy, and there's a very, very sort of strict point system that they use within the assessment.
Right.
To have any chance of really getting an award, you need to have some sort of knowledge of how that point system works.
Yep.
And most people haven't got that. They just know how it affects them, and then they just put that down on the form as they feel it.
Yeah. So a lot of people can apply simply by getting hold of the form and giving it their best shot, and that can be successful in many cases. But a lot of other people are going to struggle, and without help to do it. Do you think their chances are really affected by the form?
Oh, absolutely, yeah.
Now, you talked about the next stage, which was an assessment.
Yes.
We've had a bit of a conversation about the issues involved. How do you see those?
So the lead times are around over 3 months to get to that.
Right.
So that usually involves a professional alliance of medicine, so it's either usually run by a nurse, a physio, or an occupational therapist. And that can be a home visit, it can be visiting one of the offices, because all of these assessments are outsourced to commercial organisations, or it can be a telephone or a video assessment.
Right.
It seems increasingly that they're done by video or telephone,
right,
where obviously it's quite difficult to get across the issues that you may have. What used to happen with PIP is you went to the office and they wouldn't actually do a physical examination in terms of your strength of your arms and legs, but obviously you can't do that.
You can't do that over the phone. It's a completely different thing, isn't it? Yeah.
But obviously that's more cost effective for them to do, and they can get through more assessments in a day.
Right.
And there's a shortage of all of those professions.
And we've talked partly about the quality of assessments as being really central to the kind of journey that people have from application and when their application is rejected. Because sometimes the stuff that is in assessments, that people can receive a written transcript of it.
Yes.
Sometimes they can see straight away that's not quite what we discussed or what I said in the assessment. How do you rate the quality of assessment?
It can be very, very variable. Increasingly, the people that are applying for PIP may have a mental health condition. Very unlikely that any of these assessors have a thorough training in mental health issues. And often there are multiple disabilities that present. Mm-hmm. They are of a limited time period, usually less than half an hour.
Right, less than half an hour.
I think usually.
Wow. So those problems with assessment, they lead to a high percentage of people being rejected at that stage. Mm-hmm. And then there's another part on our figures here talking about mandatory reconsiderations. Yeah. So I remember when mandatory reconsiderations were brought in, and they were described as being a way to reduce the number of cases that go to appeal, a quicker, more expeditious way of dealing with the claim. But actually, is that what they're doing? Are they achieving that, or are people still having to go on to appeal?
Well, people are still having to go on to appeal, and the appeal success rate is still around 90%. Right. Which shows that the assessments and the mandatory reconsiderations are not really working.
Right.
If you've got a successful appeal rate of over 90%, something's not quite right in the process prior to that appeal.
Yes, that would be the question. How come so many of them are turned over at the appeal stage, and what's happening in the lead up to that should have avoided, that should have prevented the need to go to appeal, which takes months and months to get
years even.
Yeah.
We've come across cases where it's been years.
Yeah. So this is painting a picture where the whole system seems to be unfair to the people who are applying. Is that your overall impression of that?
In some ways, the resources put into it are nearly as much as what's been actually given out as benefit to try and prevent people getting that benefit, which doesn't seem to make a lot of sense.
Yeah.
But then on the other hand, the resources put into this assessment system aren't enough for the demand.
Yeah. That's true. That's what you're saying about the phone systems and the processing of applications.
And I think the average wait time for people that are trying to phone the PIP helpline is 45 minutes, average.
Right. Yeah.
And then often you'll be asked to put in your details into the automated system beforehand, and then if the queue is too large, they just then cut you off.
Oh, that's no good. That's no good for anybody. Must be really frustrating.
So people are trying to call like 8 times before they actually even get onto the queue.
Right. Thank you very much, Greg.
Thank you.
So I'm with 2 of our caseworkers who specialise in benefits. That's Tracy, Nuttall and Honey van Reeuwijk. Welcome to you both. Following the previous report that we did in 2018 and 2019, what kind of changes have there been to the systems of the benefits that you deal with, and how has that affected your work?
Well, Alan, I started as welfare benefits caseworker in 2019, around about the time of the same report, and it was really interesting to go back and read the most recent report, Nothing Has Changed, against the first one. And, I agree with you that actually very little has changed. Exactly the same issues are emerging today that I've seen all the way through the job that I've done at Citizens Advice since 2019. There are still issues with health assessors' reports. There's incorrect statements, there's omissions, there's some misrepresentations. Quite often the medical evidence still is ignored or dismissed, even when it's gone to the decision maker. And it takes a long time for people to get answers when they challenge decisions. And throughout all this time, our clients are getting more and more distressed because the frequency of reassessments is still the same, especially if you've got to go to appeal, which may happen 2 years after the initial decision, and then you get 6 months after that, they receive their review papers. So all of that is exactly the same.
Yeah, so very similar issues. No kind of improvement, no reduction in the frequency of these things, pretty much just the same errors being repeated or problems being repeated over and over.
Yes, really. I mean, the only thing that's really changed is that, despite the fact that a number of select committees have looked at these issues, either from the perspective of disability benefits as a whole or specifically at the health assessments. Even select committees, 4, 5, 6, have looked at these issues and still nothing has changed. But for really one thing, I think, and that's the fact that you can now at least ask for your health assessment to be recorded. So that if there's a difference between the health assessment report and what you believe you said, you can check that discrepancy by asking for a recording. But the problem with that is you have to ask for it before the health assessment. It's not automatically recorded.
Right, that's a really interesting point. Have you helped people based on that information that you had in a recording? Have you had that experience?
Well, because we tend to get people when they are ready to appeal, we don't really talk to them at the point before their health assessment. But I do have some clients who have asked for a recording and received a copy, and they have taken from that recording to demonstrate what they said and what is in the health report, and flagged up those discrepancies, which has then formed part of the appeal. So it has been useful.
Our report is saying assessments is sort of fundamental to, if that was right, you wouldn't have all these things.
Absolutely, yes, because it's the core. I mean, certainly for us, we approach it from the perspective of what a tribunal looks at and what a tribunal is interested in. And of course the health assessment report is essentially the DWP evidence that goes in front of the tribunal and is our evidence and our submissions that counters that particular evidence. So we do find the health assessments impact our work quite a lot. So I think it might be more interesting maybe if I just gave you an example.
Go ahead.
And this is one where I'm not sure if it was incorrect but there's an intentional misrepresentation. It was actually a client that Honey and I shared. So the person had quite severe learning difficulties. It was apparent as soon as you spoke to them on the phone that they couldn't really engage with services well, probably couldn't read or write forms terribly fluently, was at home with mum and only socialised with mum. But nevertheless, this person had managed to get a part-time job with a second-hand furniture shop. And their job was to go in the van with the man who ran the shop to do house clearances. And they helped the man pick the furniture up, put it in the van, and then at the other end, unload it at the shop. And he did about 15 hours work a week. He didn't have a driving licence because he didn't really have the cognitive skills to get a driving licence. Reading the medical assessment, they said, this person works for 15 hours a week. He works as a salesman in a furniture store.
Okay.
Now you can see the discrepancy between what was apparent and what was written. That would have been obvious to a health assessor because they would have spent an hour on the phone to this person. It was instantly recognisable by the tribunal, who went straight in to ask this person about their job and what they did, and whether he drove or whether he gave directions. And it was clear to them that and the fact that Honey had got the evidence that he'd had learning disabilities and was had an educational statement throughout his school life, that was the most likely to be the correct evidence that this person didn't have the skills to be a furniture salesman.
So, Honey, how do you think errors like that come into the system?
Well, why are there problems? I think really because the healthcare professional's reading from a script and doesn't allow the person to say, but, yes, I can do that, but. They just say, okay, you can do that. Great, let's move on to the next question.
And legally that's interesting for us, isn't it? Because part of the case law around PIP, and now in the legislation, is that people have to be able to carry out these activities reliably. They have to be able to do them safely. They have to be able to do them within a certain time frame, which is the time frame as a person without their health condition. And it has to be to what's called an acceptable standard, which has never really been defined, but is there as part of the can they do this activity reliably? Yeah. And I find that quite often that hasn't been applied in health assessments, don't you, Honey?
Yeah, definitely. And as often as reasonably required. So if someone says, they can get dressed, how often can they get dressed? Is it every day? Would it be reasonable that they change their clothes every day? Often those things aren't really looked at. And they're getting dressed, but it's every couple of days. And that bit's not explored.
What effect did the COVID pandemic have on the benefits for sick and disabled people? Were you seeing more people who were suffering from the consequences, maybe long COVID or further symptoms, or how did it affect
definitely
things?
Changed the profile of clients. I mean, our clients we've always seen clients with mental health conditions, haven't we, Honey? Sometimes ill health conditions combined with physical health conditions. But there's something different since the pandemic. The mental health conditions seem to be paramount. They seem to be much more raw. Where people had mental health conditions in the past, the COVID and the isolation of COVID seems to have exacerbated them. And indeed the cost of living crisis that's come out of COVID, that too has affected people's mental health, because if you're already struggling and then you've got no money to be able to afford your energy and your utility bills, that then feeds back into the anxiety. I think we're also finding that people can't get access to mental health services very quickly, and that's what I mean about it being more raw. Before, our mental health clients might have had some therapy with a mental health practitioner or a CPN. Now they're coming to us before they've had any access, and they can't always articulate what is causing their mental health issues, and it might be the first time they've talked to us. So it's become a more distressing conversation for much of the time.
Yeah, and people have become more isolated, I think, since COVID.
Yes.
Which impacts on their mental health.
Tell us about the appeals process. Let's just draw a bit of a timeline. Somebody would apply, and then they would have an assessment. There may be a mandatory reconsideration needed if they're not happy with the outcome of their application. How long does that often take from start to getting to the mandatory reconsideration, do you think?
I think that's changed a lot. I think maybe at the moment is it around 6 months for mandatory reconsideration, do you know?
Can be.
Yeah.
But
It used to be 12 weeks,
average.
didn't it?
Yeah, it was shorter before.
Yeah.
Then perhaps by the time they come to us, the mandatory reconsideration was a few months ago. That sometimes happens. But from lodging the appeal to having their hearing is generally a year now. So a lot of time.
A lot of time's passed since they first applied, and during that time they're not receiving anything from PIP, for example. We're talking about PIP.
If they've been totally refused, they might have been awarded something, but their limitation relates to a higher rate.
Right.
So they're asking for more. Maybe the appeal lapses and they're given something, but they're appealing for more. That also happens, so they may lodge a fresh appeal.
Right. And what's involved in an appeal? To somebody who's never done it before, what happens?
So appeals are lodged online now. They were on paper. I think that changed around COVID time. So you lodge the appeal. If you've got a representative, you add them at that point. Then the DWP responds both to the claimant and the representative. We work with the client to counter the points raised by the DWP, which usually means finding evidence that counters what the healthcare professional report has suggested or implied or actually said.
Mm-hmm. And you receive a huge amount of paperwork, which is usually referred to as an appeals bundle, is that right?
Yeah, that's the DWP response. That's all the paperwork the DWP hold on the case. So the original form, the healthcare professional report, the DWP decision making. If they ask the GP for a factual report, that'll be in there too. And then any medical evidence the client has sent in.
I've seen you working with these large quantities of paper in our office. How many pages are we talking on average?
It might just be 100 pages. If they've been claiming disability benefits for a long time, it might be 300 pages.
Right. You said just 100 pages. That's a big stack of stuff to actually go through and identify where the issues are. Is this something?
The first place we'd always go, Alan, is the health assessment report,
right.
Because that, as we've discussed already, that's largely where most
right.
of the errors are,
yeah.
and that is what the tribunal will head straight for in the packet as well. Yes, the health assessment is our first port of call.
Yeah. And is this working with this sort of appeals bundle, is this something which is intended for members of the public to do? Is that how the system is supposed? Because you're trained and experienced and you're knowledgeable on the subject, but an individual out there without an advisor would get a wad of paper like that and probably be stumped just by the amount of it. Is that the intention that the average person can respond to an appeal and do this themselves?
I think it's generally understood that you probably need some advice to manage an appeal.
How are hearings organised now?
One of the issues we have in Eastbourne is that the Tribunal Service no longer offer face-to-face tribunals in Eastbourne. So if a client of ours wants a face-to-face tribunal or an in-person tribunal, then they're going to need to travel, usually to Ashford. Very occasionally they set them up in Hastings.
Right, so
and
quite...
Brighton.
Yes, Brighton for housing.
Okay, so quite a bit of travel involved often for people who have real difficulty doing long journeys of that kind.
So basically our clients have the choice of telephone or video.
So in terms of preparing for the actual hearing itself, do you attend hearings?
I like to attend them if I can, yeah.
That's when they're done virtually by telephone or by video?
Yeah, but by the time we get to the hearing, I'm not actually that needed at the hearing. I've prepared my client for what's going to happen. The submission says everything I would say at the hearing. I'm really there to show my face so the tribunal know the client's being supported and to listen out for any difficulty the client's having with attending the hearing or any difficulty that crops up during the hearing. Yeah. Usually, I don't know about you, Tracy, I'm not actually talking much in the hearing.
Well, no, the tribunal wants to hear from the claimant themselves because what they're investigating is whether or not the claimant can carry out a specific activity, whether they've got limitations and how severe those limitations are. And we can't give that oral evidence to the tribunal because we don't live their life.
No,
only they live their life, and so that is why the tribunal wants to hear primarily from the claimant or the appellant themselves.
Mm-hmm. Honey, you mentioned about producing a written submission, which is the real way that you present the case for the client to the tribunal, is that right?
Yes, the submission that we prepare are the reasons that we support the appeal or the reasons we find the client has merit to the appeal.
Right.
And then we back that up where we can with evidence or witness statements.
And there's medical evidence that supports or is included in what you're covering in the submission, is that right?
Yeah, so quite often the DWP haven't sought any medical evidence, and unfortunately their client hadn't realised that the DWP wouldn't do this when they made their claim. So there's a gap where perhaps a PIP form was filled in, sent off with nothing. The DWP healthcare assessment was asked for. The assessment wasn't based on any medical evidence.
So I know there's a lot of work involved in that preparation. You're having to pull together bits of evidence from all sorts of different sources, sometimes statements from the person or their friends or family that back up what they're saying. How long do you usually spend on sort of preparing the written submission before the appeal, on average?
On average, it's quite hard to say in average. Say, for example, you've got someone who's got quite severe limited mobility and you're arguing for limited capability for work-related activity.
Right.
You might quite quickly find the evidence for that, perhaps already in the appeal bundle, just the DWP have missed it or misread it or not applied the law to it properly.
Right.
But you might have another client who's been awarded 0 points in their PIP and you're trying to get them the maximum because actually their limitation relates to almost all of the activities and there's 0 evidence in the appeal bundle, and maybe you need to get evidence about their mental health and their physical health, or their learning difficulties and their physical health, or whatever it may be, and the evidence for that might be from different sources like adult social care, East Sussex County Council, previous records of their education, the GP, any private therapies they've had. It's kind of endless.
Yes.
Yeah. That sounds like months worth of preparation.
Yeah.
In some of the cases. So obviously some quicker to the result, but others that would take months to get to the point of producing the written submission. What kind of waiting times are you seeing for appeal hearings to be set?
So it depends whether it's a universal credit or ESA disability benefit, the work capability assessment, or whether it's PIP, which is a non-means tested benefit. So the work capability assessments, because they are linked to earning replacement benefits, they tend to be heard more quickly than PIP, looking about 5 to 6 months.
Yeah, especially if it's a housing element appeal. They're generally prioritised, aren't they?
Yes. And then PIP, it can be up to a year now, would you say? Certainly between 9 months to a year at least.
Yeah, I've got a client who's still waiting now, and we lodged their appeal beginning of January last year.
Yes, I've got a couple that are coming up to a year now. So.
And what do you think your success rate is on appeals hearings? How often are you able to overturn the decision?
Well, we pretty much do get something for most of our clients, whether it's an uplift or some PIP. And in that respect, I mean, for me, it's about 95%. I think perhaps there's one case a year where I don't get an appeal to change a decision. So the majority of time it is round about 90 to 95%. And I think that's better than the statistics generally. I mean, what we know is that if we look at the appeals between October 2018 and September 2023, so that's quite a broad span, the DWP statistics on that is that 70% of the DWP decisions that went to appeal were changed in favour of the claimant. Now, 70% is quite a high change anyway, and I think we are able to improve on that with the additional work that we do for our clients, so they have a better chance of success.
So something that we've mentioned in the report is that the whole application process for benefit seems to treat everybody as if their case isn't genuine, and therefore it sets kind of obstacles in people's way that they have to overcome. They have to be rejected, they have to go through mandatory reconciliation, and then they have to appeal.
I mean, look, 70% of those people that go to appeal win their case. That says something about the poor quality of the original health assessment, doesn't it?
Yes. Yes.
And that for me is the demonstration.
Yes. That's definitely it. So that's confirming. And we also know that mandatory reconsiderations, I think 85% of decisions are not changed at mandatory reconsideration.
Yes, I mean the DWP always says in its evidence to the select committees that there is no target for how many mandatory reconsiderations result in a changed decision. But remarkably, the number of mandatory reconsiderations that do result in a changed decision seems to stay at the 20-25% level.
And yet you're able to overturn a significant number of those when you get to the appeal stage. So
now some of them do lapse before they get to a hearing. So a lapsing is where we've lodged an appeal, and quite often we might have included new evidence, or it might just be demonstrating to the DWP that this person intends on appealing the decision. And what we know from the statistics is that 24% of appeals that are lodged lapse before they reach a hearing, or they lapse usually before the appeal pack.
So an average annual payment of PIP can be £6,000 or £7,000, depending on where
what level they
might be scored. And some of these back payments are going to go back longer because the whole process is prolonged in that way. And that's going to make an enormous amount of difference for people who need this money to cope with daily living and travel and all the various things that affect them from their conditions.
And of course housing as well. Anything that really looks at a PIP award as being evidence of somebody's vulnerability. So for example, it can affect where you sit in terms of housing and priority need for housing.
Right, so it can have
it can affect whether or not the borough council considers they have a duty of care to you if you become homeless. What kind of duty of care they have to you. It can affect that.
Okay, thank you very much both. So as well as statistics and some case studies, our report has a series of recommendations which were based on the recommendations we made in the 2018 report. And following the theme that nothing has changed, we found that most of those recommendations were still necessary. Those are the areas in which we think changes need to be applied to prevent other people from having exactly the same problems. I'm just going to read through those now. Firstly, assessments. These need to be fair and the individual circumstances need to be listened to. There should be quality standards that are applied, and the assessor's report should be judged on accuracy. Assessors need to be properly trained and have understanding of the conditions that the claimant has. And assessment interviews need to be recorded and videoed. Assessments should be held in places that are easily accessible and also at reasonable times. So we understand now that since we wrote this report, that's one change that has applied, that assessments are recorded if you request them to be. For the process, medical evidence has to be taken into account, and mandatory reconsiderations need to be more effective. When changing benefits, from some people going from disability living allowance to personal independence payment, including the current range of managed migration to universal credit, people should be automatically transferred on the same rate and not made to reapply. The DWP should have time limits for applying to claimants throughout the process. It shouldn't be possible for a person's existing benefit award to be taken away after having requested a mandatory reconsideration. For appeals, they need to be arranged sooner without delay to reduce the stress and the waiting time. The DWP need to accept the decisions of the first tier tribunal and make payments, including hardship payments for PIP. The frequency of reassessments should be based on the conditions and the prognosis, and the same should apply to the frequency of ESA assessments, similar to PIP. Other recommendations include GP report charges should be abolished, and they shouldn't be a charge to the claimant. And application forms need to be made easier to complete for PIP, UC50s, and also attendance allowance. So those are the bulk of the recommendations that we made in 2018. And this time we've added 3 further recommendations. Short awards of PIP should only be made when it is likely that the claimant's health will improve. For clients with mental health limitations, if they do not complete a review form or make a new claim, their award should be extended to allow time for an appointee to be considered. And issues with ESA should be resolved before the client is asked to apply for universal credit, as these issues can affect the amount of universal credit paid. For example, a disability premium or being in the ESA support group. I hope you found this podcast interesting and informative, and thank you very much for listening. Bye bye for now.